Good afternoon, everyone. Thank you for joining us today's session. We will just wait another minute to let the other attendees to join us. Thank you for waiting. Dr. Rania, I think we can start right now.
Yes, thank you so much, Amar. Good afternoon, everyone. Thank you for attending today's session about the public health from the College of Health and Science. At the beginning, I just would like to ask you if you would like to scan the code on the screen so you can join with us later for the questions and answer. You can either enter the code or you can screen the QR code. You will find the code at each slide on the upcoming slide. Thank you so much and welcome to a new session from Abu Dhabi University. My name is Dr. Rania Aldweik. I am an assistant professor at the College of Health and Science in Abu Dhabi University. I'm teaching the public health program. I'm sure that recently with the COVID-19 pandemic, you heard the phrase of public health at many occasions in the news, on the social media, and in many occasions. So public health, it is not a new discipline. It's about 100 years ago discipline. However, it's a recent in our area, but it is one of the very well-established discipline and programs. So I would love to share with you this video. Join me to watch these two short videos about public health before we go ahead and talk about what is public health and what is the public health program at ADU.
When you're sick, you go to the doctor and the doctor treats your disease. They've been trained to do that pretty well. But what do you do when you're healthy? Well, you probably just go about your day. You've got a busy life. We all do. And you can't afford to be sick. So what if I told you there are people out there whose job it is to make sure you stay healthy? And what if I told you these are people you've probably never met? Well, these folks are in a field called public health, and their mission is to promote health and prevent disease. Doctors, on the other hand, are on a mission to treat disease. So let's say this person is diagnosed with diabetes. Now it's the doctor's job to treat her patient. She'll prescribe medications and insulin to help him meet his target blood sugar levels. Unfortunately, he'll have to keep going back for prescriptions for the rest of his life because there is no cure. To make matters worse, he'll have to deal with issues like long-term health complications, health insurance concerns, and even social discrimination. And don't forget his medical bill, almost $14,000 a year. His priorities in life are now secondary to his disease. Sure, modern medicine has come a long way, but is this the best way to address disease? Well, let's take a step back and focus on preventing disease. According to public health researchers, simple things like a healthy diet and regular exercise can help prevent the onset of diabetes. So public health folks put their health promotion and disease prevention mission to work. They lower the prices of healthier foods and beverages in school cafeterias to promote a healthy diet. And they build community sidewalks, trails, and bike lanes to promote exercise. And at a fraction of the cost of disease treatment, public health makes it really easy for people to stay healthy in the first place. No diabetes means no long-term health complications, no health insurance concerns, and no social discrimination. Just health promotion and disease prevention. And the crazy thing is, it works really well. Because people you've never met, people you've never even talked to, devote their time to make sure you stay healthy.
Thank you for watching this video. I have another short video as well before we start.
Even before a child is born, a quest to ensure its long and healthy life begins. All over the world, public health programs work to improve the health and well-being of communities by identifying the risks that affect different people in different places at different stages of life and finding the best ways to minimize them. It's about giving everyone the best chance to lead long, healthy, fulfilling lives from the very beginning to the very end. A child dies every 3 seconds from infectious disease, but public health interventions can prevent this by promoting things like breastfeeding, immunization, and antibiotics. Where children die because they have no access to safe water or basic sanitation, public health programs can make water safe and conditions sanitary. Where research shows us who has the highest risk of developing certain conditions, public health applies it to the real world. It turns evidence into the advice and practical help we need to lead active, healthy lives away from danger. It helps us make the right choices and form the right habits that impact on our health now and long into the future. Poor health doesn't just cost lives, it costs money too. By preventing, detecting, and treating disease as effectively as we can, public health can help to halt the spiraling costs of treatment, saving lives and saving money. Public health is about understanding the huge impact that our financial, social, and environmental circumstances have on our health, and reducing the differences between us to make us all healthier. It's about making health achievable in mind and body, at home and at work, by supporting individuals, families, and communities in the environments they live and work in. It's about working to ensure that no one is left out or left behind as we strive for better. Public health, preventing disease, prolonging life, promoting health, for everyone at every stage of life.
Thank you so much for watching the two videos. I think now we can start and talk about public health. As I said, this term now, it is very widely used term, the public health, and you hear about it every day on the social media. Every day we read about the new regulation and restriction coming from the authority. Who do you think working behind these regulation? Those public health experts and specialists, they are the one who evaluate the situation during this common pandemic, and they come up with the best practice to prevent the spread of the disease or the infection or the virus, as well as to keep people healthy as much as they can. So they are the expert behind the data that you see on the daily basis. You see the number of those who infected, you see the regulation that must be applied, and you see the health policies that they come up with it, like closing the airport, quarantine, whatever, doing the test. All those are public health experts who come up with these regulation based on an evidence-based science. So if we go to the main goal of public health program or public health in general, there are three main goals for any public health specialist. The first of all is to promote healthy lifestyle, because this healthy lifestyle will prevent the injuries and disease and will help us to controlling the infectious disease. So those are the main goals for any public health specialist or any public health organization in any society. So in this program, the bachelor degree in public health, the student will be taken over, the student will pursue a 4-year degree program, and they will complete and they will be provided with a solid and broad background in public health discipline. To be honest, the public health program started as a master's degree at the beginning of the 20th century. In the US, they found the importance of public health, and it was a part of master and postgraduate degree. By 2003, the universities and the CDC in US, they look at the importance of this discipline, and they come up with a new degree. They call it a bachelor degree in public health, which we have it in Abu Dhabi University. Abu Dhabi University is one of 150 universities worldwide. They provide the public health program as a bachelor degree. Other universities, even in the UAE, they provide only the master degree. We are the only university we provide public health as a bachelor degree. There are 5 pillars in the public health program. Whenever we talk about pillars, that means how you build this science or this discipline, and where you can find your future career in one of these pillars. So the first pillar in public health is health promotion and education. I'm sure you heard about those programs on the social media about healthy eating, about obesity, about cancer prevention campaign, breast cancer campaign, many health education campaigns and many health education programs and interventions, smoke cessation. Who come up with these programs or these interventions? Those are public health experts in the area of the health promotion and education. In UAE, especially in Abu Dhabi, majority of Saha facilities, they have a clinic for the health education, for example, for maternity education, for smoke cessation education. So experts in public health, they are the provider of this information to the public. By statistic, again, during the COVID, okay, you heard about today, the news, it says 3,600 were recorded with the COVID-19 positive. So who come up with these data? Those public health specialists who are focusing on the pillar of biostatistic. So those are working on the numbers. They look at the certain disease and they look at certain age of disease. They look at the data that already available at the hospitals, at the research centers, and they can work on these data. The third pillar in public health, it is epidemiology. Again, it is the incidence or the prevalence or how much the percentage of the distribution of certain disease. As you know, for example, you heard from the news that diabetes is one of the biggest issue as a public health problem in the UAE. Who came up with these results? Is it come just because someone come with the news? No, there was an epidemiologist who worked on these data, collected the data from the hospital, analyzed data, and it prioritized this as one of the major problems that we are currently facing. And this is one of the core pillars for public health specialists. Environmental health and safety is another pillar. I think you know that UAE mandate each one of the manufacturer and organization to have an occupational health and safety officer. Public health specialists, they can work on the policies for each occupation to maintain healthy and safe work environment. The last one is health administration. And when we talk about health administration, we talk about the health policies. If you notice that lately, I think maybe 3 years back or 4 years back, when they come up with the rules of adding tax to smoking, who decided to add tax to smoke? They are public health specialists. They're working with the other entity in the government and to reduce the number of deaths due to smoking. That's one of the policies they come up. Now, for example, the policy for repeating the test for the COVID-19. Who came up with these policies? Public health experts. Based on the data that the biostatistician, epidemiologists, they collected, the public health specialists who are focusing on health policies, they work on all these regulation and policy. The policy in the hospital, travel policy, medication safety policy, all these are public health specialists. They are working on it. So public health, they have 5 pillars. Whenever you graduate from public health degree, you can focus on one of these areas and you can pursue your future career in one of these areas. So if we go to the most important, I think, question for everyone, when I graduate, where I can find a future career for me. So as I said, either you can work as an epidemiology and researcher in hospital setting, for example, in research institute, for example, we have in Abu Dhabi, we have New York University, they have a public health research institute. Some universities, they have a research institute, Department of Health in Abu Dhabi also, and the public health center, they have a research and epidemiology department. You can work as a health educator in different hospital setting, school setting, community center, as well as clinic. You can work as an infectious control officers, either in the Department of Health, where they have a certain department. This is the department that work nowadays on this COVID pandemic, and it's not the only infectious disease that we have, but this is the most important in this situation. And also each hospital, they have an infectious control department that makes sure the hospital control any spread of the infection and maintain the safety of the hospital. Also, you can work as a public health officers in different non-profit organizations like the WHO, the United Nations. Also, you can work as a public health officers in pharmaceutical company where they need someone with a public health experience to work on the health policies, to work on the epidemiology, to work on the statistic in the pharmaceutical company. With a public health background. This is very important sentence, and it was from the American Public Health Association, and also the Journal of Public Health Epidemiology in UK, they come up with the same sentence. Every $1 we spent on prevention, okay, as a public health programs, we save $5.6 of the cost of the health spending or the healthcare cost. Also, whenever we spend $1 on the childhood vaccination, we save 16.5 in the future healthcare cost. This is very well established, and this is an evidence-based numbers. They come up with these numbers based on different studies. So they found out the importance of public health. It's not only we prevent the disease and have a healthy community, also we save our health costs, and we can spend this money on education and on better lifestyle. So if you have any question, let me know. Any question? Any question? Okay, so till you come up with your question, I would like to share some question with you. If you can go and answer this question based on the video that we watch. So the first question is about your health is by which one of those? Recommended by your diet and exercise, influenced. Can everyone participate? What do you think? Your health is space by your diet and exercise. Do you want to see the correct answer? Everyone done? Okay. Okay. I have only 7 participants. You are 20. Anyone would like to give it a try? How do you think your health will be controlled? Anyone would like to participate? So let's see the correct answer, which is on pink. It is influenced by your diet and exercise. Let's go to the next question. Which one is not a future career in public health? Is it physician, epidemiologist, biostatistician, health educator? What do you think? Okay, only 5. Which one of the below is not a future career in public health? You remember we talked about the future career where we can work. So which one of the below is not one of the future career for public health? I would love to see more participation. I just have 7 here. I can see are about 20 participants, 21. Anyone would like to add? No? So you are correct that the majority, 80%, physician is not a future career for public health. However, do you know that many of the physicians who finished or who come up with a certain year of experience, they go and they pursue their postgraduate in public health and they become an epidemiologist. Many of the physicians, if you meet them, they become interested after certain years of experience and practice as a physician. They would love to pursue their degree in public health. Next question, what is the most serious public health issue today? What do you think? Is it smoking, obesity, or cancer? We are not talking about the COVID-19 in general. What do you think? Smoking is more serious than obesity, or cancer is this serious? Is the most serious disease? What do you think? No one think cancer is a serious disease? Who else? Hello? I would love to see more. Now I have 8. What do you think the most serious public health issue nowadays? Anyone would like to participate? I have only 8. So I don't want you to surprise, but obesity is our main serious and the most serious public health issue because obesity is related to many other diseases. When they become obese, especially with children obesity, they might have diabetes, they might develop cancer, they might develop other disease. So nowadays, most of the public health specialists and researchers, they work on the obesity to find a solution and intervention for this obesity worldwide. For example, one of the states in the US, they stop McDonald's from giving those giveaways, gifts to the kids, because this will help them to improve or reduce obesity. The next question, what do public health officials do? What do you think as a public health official? Are you going to promote health education, or you will treat patients who are sick, or you will visit hospital to ensure they are meeting the safety codes? Only 3 participants. More, please. More. Okay, so correct. They promote health education. We are public health, they are not inspectors, so we are not working or visiting hospital to ensure. We might work on the health policies, but we are not used to visit hospital for the safety codes. The next question, and I think the last one, is what is a public health worker? Are they community health worker, or they are public health educator, or they develop public health policies, or they are working in all these areas? Great, I have 9 people answering. I would love to see more engagement. Anyone would like to add? So you don't think they are only public health educator? Because this is one of the pillar of the public health? Great, you are correct. We can work in all these areas. I can be a public health policy specialist. I can be a public health educator. I can be a community health worker where I save and serve my community. I can work in any of these areas. Thank you so much for joining me in today, a session about public health. I hope you have more clear vision about the public health and what is public health program. Now it's time for the questions. If you have any question, please ask me. I will be more than happy to answer your questions.
Hi, everyone. I just would like to add, if you have any questions, you can leave them down in the chat, or you can raise your hand and then I can unmute you.
Any question about the program? Any question about public health in general? Any question about any public health topic? For
Tanzil has raised his hand. Tanzil, you're allowed to talk now. You can unmute and ask your question.
Assalamu alaikum.
Alaikum salam. Yes, hi, Mr. Tanzil.
My question is that regarding the public health, that there are many rehabilitation centers for those who take drugs. So for the safety precautions, there are not so many rehabilitation centers in Pakistan. So what are your ideas and opinions about that?
As a public health specialist in the rehabilitation center, where can you fit?
Yeah.
Okay, if you plan to work in a rehabilitation center, you can fit in the mental health education. You know, one of the pillar of public health is health education, and mental health education is for under public health. So whenever you plan to work in a rehabilitation center, the most important place or where you can fit either in patient education as a part of mental health education. You can fit in health policies because all these centers, they have to comply with health policies that's related to the government policy. You can fit over there. You can work on the data collection. With these rehabilitation centers, they have some data they collected about the patient, their age, their gender, the problem. Then they can find the association between the gender, the problem, the age. They can find a lot of data that these data are very important for the top health management whenever they plan to take decision. So you can fit at any of these places, either the data collection, health education, or the health policies.
Because ma'am, this is very important that this leads to HIV, it converts to AIDS. So we have to very careful, the safety policies have to measure very careful because it can be very dangerous.
Exactly. That's why public health specialists, they have the experience and the background to come up with these policies and what kind of regulation they can come up on these rehabilitation center to prevent disease spread or even to control the disease that they have or the patient that they have.
Okay, ma'am. Okay, thank you.
You're welcome. And thank you, Mr. Tanzil. Any other question? Any other question about public health, their future career?
We have Siti Naji, who's saying that the session was so fast, and Susan Safe said that she really enjoyed the session.
Thank you so much, but I would love to repeat that for you again if you would like. So if you have anything really, I can answer your question if you would love. And I think maybe we can repost the session again.
Yes, yes. We also have a comment from Maram Al Sheikh. She said that it was so interesting. I was hoping we had more.
Sure, you're welcome, Maram. And if you have any question, Maram, I would be really happy to answer your question about public health. To be honest, public health, we call it the big umbrella of the health. Under the public health, there are many different disciplines. It's not only one discipline. People coming from environmental background can work under public health, people coming from geography. So what we look at the disease distribution based on the geographic area. So people work with the geography, they can come and work with the public health. We work with the economy. The economy, how much we save money. Remember the last slide that I show you about the US, every $1 will save $5.6 if we spend it on the health cost, about visiting the doctor. So it's a very big umbrella. We work with the medication safety. We work with the genetic background. We work with a different discipline. So it's called a multidiscipline. It's a very big umbrella that covers all different areas. While physicians, they look at the patient only from the clinical setting, we look at the prevention from every single aspect and area. We have 8 different aspects that we look at the public health or the health of the population through them, through different lenses, economy lenses. As I said, we look at geography lenses, we look at genetic lenses, we look at safety from different environmental lenses, we look at the health of the population from different lenses. That's why this program, it was a postgraduate program before. Now you are lucky you have it as an undergraduate. When I graduated from the pharmacy college, there was no public health program. I pursue my PhD in public health because it's really a very big umbrella. It's not only one science, it's a multidisciplinary science.
I think, thank you, Dr. Rania. I think Tanzil has another question.
Sure.
Go ahead, Tanzil, you're on.
I have one more last question, that too many precautions against safety can be dangerous or not?
Can you repeat that, Tanzil? I didn't get your question, sorry.
I mean to say that too many safety precautions, is it careful to be very careful or not? Is that good for health or not? Too much safety.
Too much safety is good for health or not?
Yeah.
You cannot evaluate, because whenever they come up with a certain regulation, they study it from different aspects. Because, for example, for someone who doesn't know about what's going on, you think that it's too much restriction. However, those experts who receive data from everywhere inside the country, they are able to come up with the best decision. You got me?
Exactly,
It's
ma'am.
not the issue.
I want
Of
to share
restricting.
something,
Yeah, please.
that everyone had heard about Michael Jackson. He died because he was so overprotective. He was taking so many safety precautions that his body was not up to date due to the medications. He was taking
No.
too much medications.
That's why, you see, he was overprotected. But again, you didn't know the full story about him. You don't know what kind of medicine he was using as a protected medicine, plus how was his lifestyle. So we don't have the full history. So you cannot make any judgment whenever you don't have a full history. That's what you read on the news and on the media. But what we talk about is something evidence-based science. Whenever we come up with a decision as a public health, this decision come from a story of someone. It's an evidence base. It's the data that the scientists, they collect, and they come up with these regulation. So it's not the issue of over-regulation or overprotection, but again, living healthy is the best way to protect yourself and prevent disease, right? So I'm
Yeah,
not sure
right.
about his story, because again, this has come from the media, which it's not clear. We talk about science.
So is that true or not?
Sorry?
Is that true or not?
I can't answer your question because I'm not sure about his history. But I can answer the question if you talk about any of the regulation coming up, like smoke cessation regulation, seatbelt regulation, COVID-19 regulation. This is what I can answer you.
Okay, ma'am. Okay, okay.
You're welcome.
Okay. Thank you.
You're welcome.
Thank you, Tanzil. We also have Siti Najiha, who would like to ask a question. Siti, you can go ahead and unmute yourself.
Hello, can you hear me?
Yes.
Yes, hi. Hi, Siti. I think you're muted again.
Oh, sorry. Yeah, I just have a question. Doctor, do you have any idea when will we ever get our normal life back, like how it used to be? If not, how many years do you think will we ever live like how we are living right now?
It's really a question everyone asks every day about this question, and everyone searched that. See, I will tell you something. The last crisis or pandemic was similar to this one, was the Spanish flu, and it stayed for 2 years, almost 2 years and a half, till they go down and reduce the number of the deaths. The plan now, as per the biostatistician data, they must vaccinate at least 80% of the population. Why we said 80%? There's a certain calculation when you go to public health, understand it. There's something we call R naught. That means the number of the people we need to vaccinate to reduce the spread of the disease. Once we reach the 80%, we might not return 100% fully. We cannot promise, no one can promise you with that, but at least we can go back to work, and we might not be able to take out the mask, because if you heard that yesterday, the news that even you are vaccinated, you need to keep the mask because you don't know if you're gonna spread the disease, or there is certain limit for the efficacy of the vaccine. However, vaccination is the only way to reduce the spread of the disease. That's the only thing that we have. And to approach what the WHO plan and all the health regulatory is vaccinating 80% of the population. Once we reach these goals, it is the time where we can go back gradually to our previous life. And as I told you, the last experience for the world, it was the Spanish flu. If you would like to read more, there is a very nice documentaries about the Spanish flu. We are lucky. The COVID-19 did nothing compared with the Spanish flu. It killed 50 million people. So far, alhamdulillah, it's only 2.9 million up to yesterday, which is less than what happened during the Spanish flu. However, with the vaccination, at that time, there was no vaccination. Now we have vaccination. The most important is people, they shouldn't ignore the PPI, just put the mask and take care of the hygiene, vaccinated. This is the only way we can go back to our normal life. If people, they don't adhere to these regulations, it will take longer than what they expect. So everywhere they expect by end of this year, 80% of the population worldwide to be vaccinated. And I wish, and everyone wish that will happen.
Oh, I see. Thank you very much. I just have another question concerning the vaccination. Yeah, I'm not sure if it's true, right? But like I see like in YouTube, for example, I would see like in this country, people die after taking this vaccination and this people die. So like my parents are like trying to make me get the vaccination, but I'm quite scared after seeing all those videos. So what do you think is the actual side effects that actually made these people die?
Yeah, see, just from my experience, I have a pharmacy background experience as well as public health experience. We don't have an option. The option we have is the vaccine. We don't have other options because no one can say this is not a true disease. It's a disease. Many people, they died because of the COVID-19. Many people, too many people around us because of the COVID-19. It was affecting people in different way. Some people, they are asymptomatic. They don't have anything. Some people, it hit them too strong. Some people, they passed away. And I know it is very, for the pharmacy or pharmaceutical production and industry, we don't have any medicine that come up with this short period. But we are lucky that nowadays we have the technology to come up with this medicine, and we have the fund. Before there was no fund. Now the countries, they funded all this research. So we don't have options. And whatever you see in the social media, believe me, whatever on the social media, it's usually 10% true and 100% exaggeration. No one, the social media will give you the 100% true. And all the government, they looking to have a healthy community. They want, no government, they want to get rid of their population. So they want to expose you to something dangerous. And they know the side effect. There is a track even in UAE, because I'm working with the Department of Health, they have some people who tracking all these side effects. And they know to whom they give it. That's why you see the criteria. We receive it from ADU, and you receive it even on the social media was announced. If you have any one of these disease, you have to go to your doctor. Don't take, they told you whoever are able to take it, if you are healthy, this is the only option. You don't have any much opportunity. And also, I know nowadays they compare the one coming from China with the one coming from Brazil, with the one coming from Pfizer, and they keep people, they just try it down, but they don't have strong background, and it's all social media. So I think whatever come with the country, all the countries, they go and they advise their community to vaccinate. That means it's really important, and we will never get rid of this pandemic without vaccinated 80%. This is you can if you are a public health expert, you can calculate it yourself. You don't need anyone to tell you how to find that number. So about the safety of the vaccine, there are side effects for even paracetamol. When you take it, you might take Panadol and you will not get any side effect. And someone taking Panadol and he will go to hospital because we have a human difference in our body. However, it is safe for the majority of the people. There was no severe side effect have been registered that prevent people from getting the vaccine. And I think worldwidely, everyone now is looking for the vaccine. There's no other solution. And we are lucky in the UAE because we have enough vaccine. Other countries, they don't have. If you read the news today on the national, other countries, the poor countries, they are seeking help from other countries to provide the vaccine. So for me, as per my background, if you are healthy and you don't have anything prevent you, you can go ahead. My son, my husband, everyone stay around me taking the vaccine because they are healthy. They don't have any health problems. So you can go ahead. So, and I wish we will get rid of this pandemic soon, inshallah.
Okay, thank you very much. Just last one question.
Sure, no worries.
Which vaccination do you think is the best to take?
All of them are great. All of them are good. Even Pfizer, some people, I think there is the way that the different mechanism of action of different vaccines. So the one from Sinopharm, which we have it here in UAE, it's called inactivated. So it's an inactive, it might have less side effect. Pfizer is an effective vaccine. Now it's recommended in UAE as per the regulation to be given to those people with the risk of some disease because it have some safety profile. So they keep it for those with the we call it predisposing factor or disease history. So both of them are safe. They are using safely in the UAE. So and even worldwide, not in UAE. If you look at different countries, all the countries, they take all the vaccines that are available. The issue now with the availability, not only the safety. You don't think that we don't have Pfizer because it's not safe, but because they keep limited stock. There was a lot of issue about transferring the vaccine. Vaccines is something really not easy to transfer because they have certain temperature. So each country, they have a certain forecast of the vaccine, but both of them are safe. Both of them, our regulatory body in the UAE, they approve them. So if you have to go to Pfizer, you're allowed to take Pfizer, you can go ahead. If you're allowed to take Sinopharm, you are go ahead and take it. So there is nothing about the safety. There are some side effects, we heard about them, but even if you go, the most important thing to know from where you got the data or the resources, and that's what you learn whenever you join the College of Health and Science. Whenever I want to get my data, I won't go to the news. I will go to certain WHO websites. You have to go to published paper, scientific journals. Those where we got our data. I'm not getting my data from those news who come up today and say 20 people, they die from so and so. Those are fake news. You need to go and look at the literature. When Pfizer, they said we have this efficacy and side effect, they published scientific paper that was reviewed and validated by scientists. And they look at the research, they look at the research method, they look at the medicine, they look at every single thing, and they come up with this information. So whenever you want to take your data, never go to social media and read the data. Go to certain either something .government, the government that they issue this information because this is reliable information, or go to scientific journal. But don't go to social media because you will not get the real data or information.
Okay, thank you very, very much for all your answers, Doctor.
You're welcome. I'm much happy to answer you. I wish you will be, inshallah, in very good health and make your decision about your vaccine, Siti.
Thank you, inshallah.
Thank you.
Thank you so much.
Siti. Tanzil has his hand raised. I think he has another question.
Sure.
Tanzil, go ahead and ask your question.
Yes, Tanzil.
Yeah, sorry to interrupt you, ma'am. One more last question I want to ask that What are the best evidence-based interventions to support population health literacy?
Okay, health literacy is something very big issue. I have a new research about health literacy because, again, it's different from region to region and from area to area. If you want to compare health literacy in Middle East with the, you want to compare health literacy with Far East with the North America, or there's a different way. In North America, usually over there we teach health literacy from grade 1. So when they grow up by grade 12, they know all, you know what's the meaning of health literacy. That means whenever you hear anything about health, you will be able to translate this information. Okay, so health
Okay,
literacy
okay.
is something new in our region and the Far East region, and it's very well developed in the North America and Europe, not because we don't want to develop that, because we're still looking at this area. So many countries, they working now on they work at the beginning on literacy. You know, the number of the literacy or the percentage of the literacy population, illiterate population, it's reduced or recognizedly reduced over the last years. Now they are working on health literacy, where I will educate my population to understand whenever they talk about anything related to health, each one of us as a member of the population should be able to translate what that means. I don't want, whenever I speak to the physician, to have a barrier between I'm not understanding what he's talking about. So this is what the researcher nowadays they're working on, and all the countries and the governments they're working on improving health literacy for their population. Whenever I improve health, I'm improving the health of my population. I wish this
Uh,
answer your question, Tanzil.
Okay, thank you, ma'am, so much. Thank you so much.
You're welcome. Any other question? Harim, you are muted.
No, no, I'm muting myself.
No, Harim, Miss Harim, she's muted.
Oh, sorry.
No
I'm
worries.
just saying if anyone else has a question, please raise your hand and I will unmute you. Tanzil, do you still have one more question?
No, no, ma'am, I'm sorry. My
Oh,
questions are finished.
okay. Thank you.
Any question?
You can also type it in the chat if
Yeah.
you have any questions.
If you have any question, if you'd like to type it on the chat, I'll be happy to answer your questions.
Tanzil says that it was a very interesting session.
Thank you so much.
Thank you, Tanzil.
I'm not sure about the background of the participant, but whenever you have any question, I think Harim, she can share with you our email where we can answer your questions in future. If you would like to ask about the public health program or any question that you think about, it will be more than happy to answer your question. Thank you so much for attending today's session, and thank you for those questions as well. I would be more than happy to answer any other question. Thank you so much.
Thank you for your attending. Thank you.
Thank you, everyone. Thank you. Have a great day,
Thank you,
everyone.
Dr. Rania.
Thank you so much.
Thank you so much.
Thank you, Amir. Bye.